I'm Vicky Smith, I'm a GP and I work at Courtside Surgery in Yate. Yep, so obviously if we've been seeing with people with COVID, so mostly over the phone, then it's difficult to get a good assessment of them sometimes, and it's been really useful to be able to get the equipment out to them to measure their oxygen levels. And sometimes that means they don't have to come up to us, which is really helpful, and it also means we can monitor for any deterioration, so we can keep a much closer eye on them without having to get them to come up to us, risking spreading infection or coming out of the house when they're feeling really unwell. So it's really helpful. So we had a gentleman that we weren't really sure how unwell he was over a course of a couple of days, and it was really helpful to know that the oxygen level had changed, and when he was sailing he felt very unwell. Then we had some really good evidence that that was true, and we admitted him to hospital. So more about getting people in than necessarily keeping them out, but I guess we don't see the ones that we keep out as much because they're nicely monitored by Sirona and we don't have to worry about it. And it also can be really reassuring as well, I think, because obviously it's a bit of a scary thing when you're told you've got COVID and then you don't know what's going to happen, and people often get much more unwell before they get better again over quite a number of weeks sometimes. So it's really nice to have that backup of knowing someone's got an eye on you, even if it's not, someone that you're seeing, it's someone remotely keeping an eye on them, I think. So I think that is really helpful. Anything we can do to make them feel less anxious whilst they also feel really unwell is really important. And if it spots people getting sick and helps them not to get so sick so quickly, then that's great. So I think it's been really important. And especially in a world that's changed so quickly, it's amazing they've managed to get it set up and working so quickly.